For many of us, our pets are absolutely family. And seeing a healthy, happy female dog or cat, just full of life, it's really one of life's great joys. But here's something critical, something every owner of an unspayed female really needs to be aware of. There's a serious, often hidden health threat lurking that can turn that joy into, well, profound worry very quickly. Today, we're delving deep into Pyometra. And this is just some minor infection. It's a severe uterine infection, primarily affecting unspayed female dogs and cats. And when we say severe, we really mean it. If it's left untreated, Pyometra can rapidly become life-threatening. It can lead to multi-organ failure and even, tragically, death. So our mission with this deep dive is to equip you, the listener, with a really comprehensive understanding of this condition. We'll be pulling insights from, well, a stack of sources to give you the most important nuggets of knowledge. We're talking causes, the crucial signs to watch for, how it's diagnosed, treatment options, and maybe most importantly, how you can prevent it. Okay, so let's break this down. What exactly sets the stage for such a serious infection? It really sounds like a perfect storm of factors.
It really is. What's fascinating and also quite scary is that it's truly multifaceted. Yeah. It's almost like the body's own systems conspire with invading bacteria. We're looking at a combination of hormonal changes, alterations in the uterine structure, and then, of course, bacteria, all creating this ideal environment for infection. And this typically happens after the estrous cycle, what most people call heat, specifically during the luteal phase. That's when progesterone levels are high and stay high for weeks.
Progesterone. Okay, so that's the pregnancy hormone, right?
Exactly. Progesterone plays a critical role. It's the hormone that tells the uterus, hey, get ready for a potential pregnancy. So it stimulates the uterine lining to thicken up, and it secretes something called uterine milk, preparing the nursery, essentially. But here's the crucial part, the downside if no pregnancy occurs. This same hormone also suppresses the uterus's natural muscle contractions, the ones that would normally flush things out, and it weakens the local immune response right there in the uterus.
So it's doing two things that make infection easier: stopping the cleaning process and lowering the defenses.
Precisely. It makes the uterus incredibly vulnerable. And to complicate things further, estrogen, or even synthetic estrogen drugs sometimes used, can actually amplify these negative effects. The really critical factor here is that repeated heat cycles where the dog isn't bred lead to this accumulation of hormonal effects. The risk just builds up over time.
That makes sense. It's like the uterus is constantly being prepped for a party that never happens, and eventually the preparations themselves cause problems. So what does that physical buildup actually look like inside? How does the uterus change structurally?
Yeah, that's a great question. It leads directly to the uterine structural changes. This long-term hormonal stimulation, especially in an unbred uterus, often causes something called cystic endometrial hyperplasia, or CEH. Basically, the uterine lining gets persistently thick and it forms these little fluid-filled cysts. And these cysts, along with the thickened lining, then secrete even more fluid into the uterine cavity. It just creates this perfect soupy breeding ground for bacteria. Now, the exact terminology scientists use for this overgrowth has evolved a bit, but the core idea remains. The physical structure of the uterus changes in a way that makes it prone to infection.
Okay, so you have this vulnerable, fluid-filled environment, and then the bacteria arrive. What kind of bacteria are we mainly talking about here?
By far, the most common culprit is E. coli. It's responsible for a huge percentage of canine cases. Some studies say 28%, others up to 90%. It really varies.
Wow, E. coli. Like the stuff that causes gut issues.
Often related, yes, though these are specific strains, but it's not the only one. Other common microbes include Staphylococcus, Streptococcus, and Klebsiella. These bacteria usually travel upwards, ascending from the rectum or the vagina. And remember how the cervix relaxes during estrus?
Right, during the heat cycle.
Exactly. That relaxation basically gives them an open door right into that hormonally primed, vulnerable uterus. And some specific strains of E. coli are known to be particularly nasty, causing more severe infections. Intriguingly, some studies have even suggested possible transmission between dogs living together.
Really? Like it could spread?
It's been reported, yes.
Yeah.
It's not the main way it happens, but something to be aware of. Very rarely we might see cases where bacteria spread through the bloodstream from another infection site, but that's less common.
Okay, that's a lot of factors. Hormones, uterine changes, bacteria. Are there any other maybe surprising risk factors that make a pet more vulnerable?
There absolutely are. Age is a big one. It's most common in middle-aged to older dogs. The median age at diagnosis is around 9 years, but honestly, it can happen anytime from 3 months old up to 20 years.
So it's not just an old dog disease.
Not exclusively, no.
Yeah.
And perhaps unsurprisingly, being unspayed is the biggest risk factor. Studies estimate unspayed dogs have somewhere between a 19 to 25% chance of getting pyometra by the time they're 10. That's significant.
1 in 4 or 5 dogs.
Wow. Yeah. Medication use is another key factor. Hormonal drugs, sometimes given for reproductive control, like certain progesterone or estrogen compounds, are known triggers. Even something like a false pregnancy can increase the risk. If the uterine contents aren't fully expelled when the cervix closes back up, that can trap material inside. There's also evidence of genetic predisposition. For instance, a specific gene, ABCC4, has been linked to increased risk in golden retrievers.
Interesting. So breed can play a role.
It seems so in some cases. And here's a fascinating, though maybe indirect, link: diet. Some researchers suggest diet could potentially influence the types of pathogenic E. coli that colonize the gut, which could then potentially increase risk. More research is needed there, though. And finally, things like retained fetal or placental tissue after giving birth, or any kind of physical obstruction in the uterus, can also increase the risk.
Okay, so given all these potential causes and risks, what does this actually mean for you, the pet owner at home? What specific signs should you be looking out for, and when do they typically show up after a heat cycle?
Right. This is crucial because the signs can vary quite a bit, and the big difference depends on one thing: whether the cervix is open or closed. But generally, you'll see symptoms starting about 2 to 8 weeks after the last heat cycle. Some common general signs, which you might see with either open or closed pyometra, include lethargy or depression just not being themselves. Also, anorexia, a loss of appetite, and this is a really important one: polydipsia and polyuria. That just means increased drinking and increased urination, PUPD, we call it.
Increased drinking and urinating. Why does that happen?
It's often one of the earliest signs. It's caused by the bacterial toxins, the poisons produced by the bacteria affecting how the kidneys function, specifically their ability to concentrate urine.
Ah, okay, so the body's trying to flush something out, in a way.
Sort of, but it's more that the kidneys aren't working properly because of the toxins. So definitely watch for that excessive thirst. Other signs can include vomiting, diarrhea, maybe a fever, or sometimes even an abnormally low body temperature, which is serious. A rapid heart rate, rapid breathing, general weakness, weight loss, or even in severe cases, unusual collapse.
That increased thirst. Many owners might just think their dog is hot or needs more water for some other reason. Is there anything distinctive about the PPD and pyometra?
Often it's the suddenness and the sheer amount. It's usually not just a little bit more water, it's noticeably excessive drinking and urinating that seems out of character. Now let's talk about that critical difference: open versus closed cervix. In open pyometra, the signature symptom is vaginal discharge.
Okay, what kind of discharge?
It can be purulent, which means pus-like, maybe creamy or yellowish. Or it might be bloody purulent, sort of reddish-brown. You might notice the dog cleaning under her tail a lot more frequently. Or you might find spots of this discharge on bedding, furniture, or the floor. The slightly better news with open pyometra is that the symptoms are generally less severe. Because the cervix is open, that pus can drain out. This relieves some pressure inside the uterus and means fewer toxins are absorbed into the bloodstream.
Okay, so drainage helps. But I'm guessing closed pyometra is where things get really dangerous, right? Because if it's not draining, it's just building up inside.
Exactly. Closed pyometra is much, much more dangerous. The cervix is sealed shut, trapping all that infected material, all that pus, inside the uterus. This often leads to classic signs like abdominal distension, a bloated-looking belly, and you can bet there's significant abdominal pain. The dog might be reluctant to move or cry out if you touch her belly.
And the toxin.
They have nowhere to go but into the bloodstream. Dogs with closed pyometra can become severely ill very, very rapidly because those bacterial toxins get absorbed systemically. This leads straight to sepsis, which is a life-threatening body-wide infection, and endotoxemia, where the toxins themselves trigger a massive, damaging inflammatory response throughout the body. The prognosis for closed pyometra is significantly worse than for open. It's a true emergency.
And what are the worst-case scenarios if it progresses?
Well, the most feared complication is uterine rupture. The uterus gets so full and stretched that it actually bursts, spilling pus directly into the abdominal cavity. This causes peritonitis, a massive abdominal infection, which carries a very high mortality rate, sometimes up to 50%, even with treatment. Beyond that, we can see severe kidney dysfunction or outright kidney failure because of the toxins. Coagulopathy, which means problems with blood clotting leading to potential bleeding issues, and ultimately, shock and collapse.
This sounds incredibly serious. So if you even suspect something might be wrong, getting to the vet quickly is paramount. How do vets actually piece together the puzzle to confirm a diagnosis, especially if it's closed, without that obvious discharge?
You're absolutely right. Speed is critical. Diagnosis involves a combination of careful detective work, listening to the owner, and using some powerful diagnostic tools, particularly imaging. They'll always start with the pet's history, asking detailed questions. When was her last heat cycle? Is she spayed? What symptoms have you noticed, and when did they start relative to that heat cycle? Then comes the physical exam. The vet will carefully palpate the abdomen, feeling for an enlarged, possibly firm or fluid-filled, and likely painful uterus. And of course, they'll check for any vaginal discharge, even if the owner hasn't seen any. There are definite red flags. If an unspayed female dog suddenly starts showing that increased drinking and urination, the PUPD, along with poor appetite or lethargy, maybe some abdominal distension, Pyometra jumps way up the list of possibilities. It should be highly suspected right away.
Okay, history and physical exam point towards it. What tests confirm it?
Next step is usually laboratory tests. A complete blood count, or CBC, often shows a really high white blood cell count that's leukocytosis. It shows the body's trying hard to fight a major infection. But interestingly, the white count can sometimes be normal or even low. This can happen if all the white cells have rushed to the uterus, or sometimes an overwhelming sepsis when the body's defenses are starting to fail. Anemia, a low red blood cell count, might also show up.
So the blood count isn't always straightforward.
Not always, which is why we look at other things too. Blood chemistry panels are vital. They might show azotemia, which indicates waste products building up in the blood, often pointing to kidney dysfunction caused by those toxins. We also often see elevated globulins, which are proteins associated with inflammation and infection. And a urinalysis is important too. It frequently shows decreased urine-specific gravity. That means the urine is very dilute, reflecting that impaired kidney concentrating ability. We talked about another effect of the toxins.
Are there any specific markers vets look for?
Yes, biomarkers can be helpful. C-reactive protein, or CRP, is typically quite elevated in Pyometra. Measuring CRP levels can help assess how severe the inflammation is and even give some idea about prognosis. Other markers like serum amyloid A might also be high.
Okay, blood and urine tests provide strong clues. What about actually seeing the problem? What imaging is used?
Imaging is really key for confirmation. Abdominal x-rays or radiographs can sometimes help. They might show an enlarged, fluid-filled uterus, which is usually more obvious in closed Pyometra where it gets really big. However, x-rays might not be definitive, especially in open cases where the uterus might not be hugely distended or very early on.
So x-rays might miss it sometimes.
They can, yes. Which is why ultrasound is generally considered the gold standard, the most accurate diagnostic method for Pyometra. Ultrasound is excellent. It can detect fluid inside the uterus, even if the overall size isn't dramatically increased. Plus, it's really good at differentiating Pyometra from other things that might look similar, like a normal pregnancy, or other uterine or ovarian problems like cysts, or just the CEH changes without infection.
Ultrasound sounds definitive then.
It's usually the most definitive, non-invasive test, yes. And then there are a couple of other tests often done, especially once treatment is underway. A sample of the uterine contents, the pus, can be sent for microbiological culture and antimicrobial susceptibility testing. This tells us exactly which bacteria are involved and, crucially, which antibiotics will be most effective against them. And after surgery, if an ovariohysterectomy is performed, the removed uterine tissue is often sent for histopathological analysis examination under a microscope. This confirms the diagnosis definitively and identifies the underlying uterine changes, like the CEH.
Right. So once all these pieces fit together, the history, exam, lab tests, imaging, and Pyometra is confirmed, what's the immediate next step? Because you said it's an emergency. It sounds like you can't just watch and wait.
Absolutely not. There's no watching and waiting with Pyometra. It requires swift, decisive intervention. The preferred treatment, and the one that's truly curative, is surgery. Specifically an ovariohysterectomy or OHE, what most people call a spay, but it's often more complex in these cases.
Removing the uterus and ovaries.
Exactly. This removes the source of the infection entirely. It permanently eliminates the problem with a very, very low chance of recurrence. Now, it is a more challenging surgery than a routine spay, especially because the animal is usually already quite sick, maybe dehydrated or going into shock. The uterus itself can be large, fragile, and full of pus. But despite the challenges, most dogs recover well with appropriate care.
What does that care involve before and after surgery?
For severe cases, immediate preoperative stabilization is crucial. This means getting them on intravenous fluids right away to correct dehydration and support circulation. Broad-spectrum antibiotics are usually started immediately, even before surgery, to begin fighting the infection systemically. Post-operatively, care involves continuing those IV fluids, managing pain, and continuing antibiotics, often for about 2 weeks based on the culture results if available. Close monitoring of vital signs, heart rate, breathing, temperature, and kidney function is really important during recovery.
Are there significant risks with the surgery itself, especially given the condition?
Like any major surgery, there are risks. Bleeding or hemorrhage is a concern because the tissues can be inflamed. There's a small risk of accidentally tying off a ureter, the tube from the kidney to the bladder. Things like ovarian remnant syndrome, where a small piece of ovary is left behind, or uterine stump pyometra, where the small remaining part of the uterus gets infected later, are possible but less common complications. But the most critical risk, the one surgeons are extremely careful to avoid, is uterine rupture during the surgery. If that infected uterus tears and spills pus into the abdomen, it causes that severe peritonitis we mentioned. And the mortality rate associated with that is frighteningly high, potentially up to 50%.
Wow, so the surgeon's skill and care are absolutely critical.
Absolutely. And often during the surgery, they'll take a sterile sample of the pus for that culture we talked about, and maybe a biopsy of the uterine wall for analysis.
Okay, so surgery is clearly the gold standard, the definitive fix. But what about medical management? Is that ever a realistic option? Maybe if surgery is just too risky for a particular dog, or if an owner really wants to preserve breeding potential.
Medical management is an option, but it's reserved for very specific, carefully selected cases. It's definitely not the first choice for most situations. Primarily, it might be considered for younger dogs, valuable breeding animals where preserving fertility is a major goal, or perhaps for animals where the risk of anesthesia and major surgery is deemed extremely high due to other underlying health problems.
And how does medical treatment work? What drugs are used?
The key medications fall into two main groups: antiprogestatives, like a drug called aglapristone, and prostaglandin F2A analogs, such as cloprostenol or dinoproust. Basically, these drugs work together. The antiprogestative blocks the effects of progesterone, that hormone that's driving the problem. The prostaglandins help to relax and open the cervix, and they stimulate the uterine muscles to contract strongly, hopefully expelling the pus. They also seem to have some effect inhibiting bacterial growth.
So it tries to mimic what the body should have done, forcing the uterus to empty.
In a way, yes. But there are significant limitations and risks involved. Firstly, success rates are highly variable. It doesn't work for every dog. And even when it does initially work, the recurrence rate is unfortunately very high. Studies suggest up to 70% of dogs treated medically will develop pyometra again, often within 2 years.
70% recurrence. That's huge.
It is, and the prostaglandin drugs, while necessary, can cause some pretty noticeable, though usually temporary, side effects. Things like restlessness, panting, sometimes vomiting or defecation, excessive salivation, and abdominal cramping or pain. These side effects typically show up within about 15 minutes of the injection, can last for a few hours, but they tend to lessen with each subsequent treatment.
And you wouldn't use this for the really sick dogs, right? The closed pyometra cases.
Absolutely not. Critically, medical management is not suitable for severe cases, and definitely not for closed pyometra. It's simply too slow. It often takes 2 to 4 days before you see a significant effect. And during that time, in a closed case, the risk of that uterus rupturing is just unacceptably high. Surgery is needed immediately for those dogs.
What about fertility afterwards? If someone chooses medical treatment to preserve breeding?
That's an interesting point. It was previously thought that medical treatment might significantly harm future fertility. However, some more recent studies suggest that future pregnancy rates and litter sizes might not actually be decreased, which is encouraging. But if breeding is the goal, it's generally recommended to try and breed the dog on the next heat cycle soon after successful medical treatment, because the risk of recurrence is always there.
And regardless of treatment choice, Supportive care is vital.
Oh, absolutely essential for all patients, whether they have surgery or medical management. This includes aggressive fluid therapy to rehydrate and support organs, effective pain relief, nutritional support if they aren't eating, and sometimes oxygen therapy if they're having trouble breathing. It's a whole body approach.
So we've covered the causes, the signs, diagnosis, and treatments. Let's talk prevention, because prevention is always better than cure. Right, especially when the cure involves major surgery and serious risks. After everything we've discussed, what is the single most effective way to avoid all of this heartache and danger?
Well, if you connect all the dots back to the hormonal influence in the uterus itself, the most effective, most definitive prevention is really quite clear. It's spaying, ovariohysterectomy. Removing the uterus and ovaries completely eliminates the hormonal cycling that sets the stage for pyometra, and it removes the target organ itself. Spaying completely prevents pyometra. There's zero risk afterwards.
It seems pretty straightforward then. Spay your dog, prevent pyometra.
It is the definitive prevention for this specific life-threatening disease. Now, it's only fair to acknowledge as vets that spaying, like any procedure, isn't entirely without potential downsides. There are the immediate surgical and anesthesia risks, though they're generally low in healthy animals undergoing routine procedures. And some studies suggest potential links between spaying, especially early spaying, and a slightly increased risk of certain musculoskeletal issues like cruciate ligament tears, some types of cancer, endocrine problems like hypothyroidism, obesity if diet isn't managed, or urinary incontinence later in life.
So there are other factors to consider.
Yes, and it's crucial for owners to have that discussion with their veterinarian, weighing the pros and cons for their individual pet, considering breed, lifestyle, and other health factors. But specifically for the prevention of pyometra, a common and potentially fatal condition in unspayed females, the benefit of spaying and eliminating that risk is usually considered to far outweigh the potential downsides for most pets.
Right. Spaying is the gold standard for prevention. Are there any other measures people can take, especially if they have an unspayed older female?
Definitely. If a dog remains unspayed, especially as she gets into middle age and older, regular veterinary health checkups become even more crucial. Routine exams might help catch subtle early signs before she becomes critically ill. We should also be very cautious about, or ideally avoid, using those hormonal drugs for reproductive control or treating other conditions as we know they can be triggers. Looking towards the future, there might be more research into that diet link, how influencing gut bacteria, perhaps with probiotics or specific diets, could potentially reduce the colonization by those pathogenic E. coli, but that's still speculative.
What about managing risk if you have multiple dogs? You mentioned potential transmission.
Yes, while the exact risk isn't fully clear, it's probably prudent advice to isolate healthy dogs living in the same household from a dog that has active, open pyometra with vaginal discharge, just as a precaution. Basic hygiene is always good too. Keeping the animal's environment clean can help reduce overall bacterial load. And while it's hard to quantify, generally reducing excessive stress might be beneficial, as high stress levels can sometimes compromise the immune system and potentially increase infection risk overall.
Wow. That was a truly comprehensive deep dive into pyometra. It's really quite something, going from that tricky hormonal dance that sets the stage to the critical difference between open and closed cases, and ultimately the absolute importance of prevention, primarily through spaying.
It really does highlight how just being informed, knowing about these common serious pet health issues can make all the difference, doesn't it? Knowing those early signs to watch for, especially something seemingly simple like increased drinking and urination, recognizing that could genuinely be life-saving for your pet. It prompts you to seek veterinary care sooner rather than later.
Absolutely. So after hearing all this, what does it all mean for you, the listener? Here's something to think about. If closed pyometra can be so severe and sometimes so silent in its early stages without that obvious discharge, perhaps it really nudges us to think differently about those routine health checks, especially for our unspayed pets as they age. What conversations might you have now with your vet, or maybe even with other pet owners you know? How can you use this knowledge to better advocate for the health and well-being of our beloved furry companions?